All right, let's get right into it. We're talking about facial fillers today, a topic that's really this incredible mix of medicine, science, and straight-up artistry. In this explainer, we are going deep, literally beneath the skin, to uncover the one thing that separates a fantastic result from a really dangerous mistake. And that one thing? It's all about a deep, deep understanding of facial anatomy. I mean, it's no secret that fillers are massively popular. We're talking millions of procedures every single year. They've become a go-to for people looking to restore a little volume or enhance their features. It's pretty much a staple of modern aesthetics. But here's the thing. With that huge popularity comes a really critical question. When you're working with the incredibly delicate and complex structures of the human face, the line between an amazing result and a terrible one is razor thin. So what's the secret sauce? What makes it all work safely and beautifully? Well, the answer is way more fascinating than you might think. And this brings us to what I like to call the filler paradox. You've got this wildly popular, super effective procedure on one hand, but on the other, you have some very real and very serious risks that you just can't afford to ignore. This right here frames the whole challenge perfectly. The goal, what everyone wants, is that safe, natural, harmonious result. But then you look at the risk column and you see words like tissue death, blocked vessels, even blindness. And the only key to staying on the left side and avoiding the right is mastering the anatomy of the face. So, to really get this, we have to go on a little journey. We're going to peel back the layers, so to speak, and look at the face not just as a surface, but as the complex, three-dimensional structure it truly is. You know, an expert injector doesn't just see a face, they see these 5 distinct layers. It starts with the bone, deep down, and goes all the way up to the skin. Think of this as the essential map. Every single layer has its own job, and knowing how they all interact is the absolute foundation for doing this right and doing it safely. Okay, so it all starts with the foundation, the bone. This isn't just some passive frame, it's the actual scaffold that everything else is built on. As we get older, we can lose bone, which affects the whole structure. That's why a skilled injector will place filler right on landmarks like the cheekbone or jawline. They're not just plumping things up, they're recreating that deep, stable support for a lift that looks natural and lasts. Next up, we've got the fat compartments. You can think of these as the face's natural cushions. They're what give us those soft, youthful contours. But over time, they shrink and can even start to droop. An experienced injector knows the exact location of these pads and can strategically place filler right where that volume has been lost. It's all about precision, which is how you avoid that overfilled look. Then you have ligaments. These are like the face's own internal support system. Think of them as tiny little anchors, holding all the soft tissue in place against the deeper layers. An injector has to work with these anchors, not against them. If you disrupt them, you can actually cause sagging, which is the exact opposite of what you're trying to achieve. But look, a good map doesn't just show you the safe paths. It also has to clearly mark the danger zones. Once you understand the layers, you also have to know where the metaphorical dragons are hiding, the high-risk anatomical areas where one wrong move could have devastating consequences. Now, this isn't meant to be scary, it's about being informed. In these specific spots, really important arteries run close to where injections happen. The glabella, that spot between your eyebrows, has a direct vascular connection that can lead to blindness. The nose, the temples, even the lips. Every one of these areas has its own vascular roadmap that a practitioner absolutely has to know like the back of their hand. And that really drives home this crucial point, which this quote just nails. Understanding anatomy isn't just about aesthetics or getting a good result. It's about a fundamental duty to keep the patient safe. This knowledge is, and I'm not exaggerating, a life-saving tool. So, how does an expert take all of this incredibly complex anatomy theory and actually turn it into a safe, effective technique? Well, it all comes down to having a crystal clear blueprint for every single procedure. It really starts with choosing the right tool for the job, because not all fillers are created equal. If you're going deep, right down to the bone for structural support, you need a thick, firm filler, one with a high G prime, which is just a fancy way of saying it's stiff. But for those delicate, fine lines closer to the surface, you're going to use a much softer, thinner filler. The anatomy of the target tells you which tool to use. And here's that blueprint in action. It's a very deliberate 3-step process. First, you assess. You physically feel for the bones and the pulse of arteries to understand that person's unique landscape. Second, you plan. You map out exactly which layer the filler is going into. And third, you inject. using specific techniques like going slowly and carefully to minimize any risk. See? Anatomy drives every single step.
So this brings us to the final and maybe the most important idea of all. It's this beautiful equation where the deepest scientific knowledge is actually what makes true artistry possible.
Let's be clear. The best results, the ones that look so natural you can't even tell anything was done, they don't happen by chance. They're the work of an injector who isn't just an artist with a syringe, but also a meticulous scientist who has completely mastered that complex world beneath the skin.
So what's the big takeaway here? It's that mastering anatomy is everything. It's what allows a practitioner to give you those beautiful, natural results. It's how they avoid those scary complications. It's how they can customize the treatment just for you because every face is different. And at the end of the day, it's how they make sure their patients are safe and thrilled with the outcome.
And we'll just end on this thought because it really says it all perfectly. When it comes to fillers, the line between artistry and risk, between a masterpiece and a mistake, isn't luck, it's knowledge. A deep, unwavering respect for the anatomy of the human face.